The bereavement process has already started when you're looking after someone with dementia at quite an early stage, because you gradually lose that loved one over an extensive period of time. So the person that you loved isn't necessarily the person who you're going to be supporting at end of life. I'm Dr. Wendy Wesson. I work at the University of Derby. I've worked here for 11 years. Prior to that, I worked as a district nurse, a specialist practitioner in the community in and around Derbyshire, various locations. Headed up a team of nurses who managed and supported patients in the community with various illnesses, diseases, post-surgical issues. I currently also work as a hospice at home nurse for a local hospice, which involves caring for patients at end of life in their own homes, supporting their families and carers. The district nursing role involves a lot of liaison with other agencies, and that was a really vital aspect of enabling people to stay at home. I can't think of one individual patient who didn't want to stay at home, didn't express the preference to be in their own environment. And so the role was largely around supporting those individuals. We often used to have to support individuals whose carers were really at the end of their tether, and so the support was often to enable them to manage and care for that person, their loved one at home. That involved lots of different agencies, private, voluntary, community agencies, and that involved lots of engaging perhaps agencies that wouldn't traditionally have been involved in end-of-life care for people with dementia. My advice to a relative of a person dying with dementia would be not to expect anything, not to try and anticipate what's going to happen over the following few days, weeks, to grasp any offer of help that's given, to not beat yourself up about things that don't go quite as they should, to realise that actually often what you expect of the person that you loved may not be what happens. Somebody dying with dementia, and throughout the period up to that end of life period, will have some very unusual reactions and responses to situations which would have been the norm previously. So I suppose my advice would be to you can only do the best you can, and there's nothing wrong with asking for support, help and guidance. There's also a lot of guilt often with somebody who is losing a loved one with an illness like dementia, of guilt around not being able to make the person recognise what's being done for them and why it's being done for them. I think our responsibility as health and social care professionals and as helpers, carers, supporters, is to take that guilt away and to just enable them to, or support them to be aware of the fact that they are doing the best they can. They're giving of what they can at that particular time, and that there's no shame in asking for help and support, especially when they're going through a grieving process already and feeling bereaved and feeling the loss of the individual gradually happen. And so any support that we can give to prevent that person feeling any guilt or any responsibility other than the caring responsibility, if we can give them the support to feel better about those things, then that's what we should be doing.